the Kentucky Pharmacists Association and the Kentucky Board of Pharmacy. I'm Joel Thornberry. I am the present president of the association, and we're very fortunate and lucky to have this opportunity. I'd like to welcome Larry Hadley, the executive director of the Board of Pharmacy, and Sam Willett, the interim executive director of the Pharmacists Association, and Ben Mudd, our incoming executive director, who will start the 1st of February. I'd also like to welcome Dr. Jill Rhodes, who is the president of the Board of Pharmacy, who has a couple of remarks to begin.
Yes, Dr. Stack and everyone in our profession, thank you for spending your lunch hour with us today. Dr. Stack, thank you for offering to speak with the Kentucky pharmacists about the COVID immunization strategy. Today, we currently have a little over 6,000 in-state pharmacists who are providing care, as well as 1,332 pharmacies in the state that cover and provide care to all residents and citizens of Kentucky and Emory County. Many of our pharmacists have already been actively engaged in vaccine distribution and immunization efforts, as you are aware, and many, many more are at your ready. So they're prepared and poised to help you, work with you, and support us in this effort to improve the Commonwealth care. And so I would love to hear from you, as everyone else. So I'm going to stop talking and say thank you.
Thanks, Jill. I'd also like everyone to know that we are privileged to have with us an incredible Department of Public Health. Pharmacists are in tune to what is going on in the public health from day one for over 200 years. Today we have Rebecca Gillis, who is with the Department of Public Health, Angela Kick, Dr. Emily Massarelli, and our own esteemed Michelle Pinkston, who has been there working from day one on this pandemic and everything. So with no further ado, I'm going to basically turn it over for the star, Dr. Stephen Stack. Welcome, Doc.
Thank you very much, Joel and Jill, and thanks for the opportunity to talk with all of you. And again, I'm grateful that you've taken the time to join us today. And to my team, just to acknowledge for Michelle Pinkston, Emily Meserly, Becky Gillis, and Angela Kick, who are invaluable members of our team. Thank you for all you do to help support pharmacists as we go forward in this, but also in the bigger context, I've worked with them, help support public health and our emergency response to COVID-19. So obviously we're here today. The most timely topic has to do with the vaccine, so I'll just focus on that. But let me give just a little perspective if I can. As you all know, we're in a once-in-a-century pandemic. Let's hope it's only once in a century and we don't have another one soon following it any time, because I won't be your commissioner if we have another one happen next year. Once is enough for me. So this has challenged all of humanity, really, quite frankly. It has, unlike H1N1, where we were worried about that in 2009 and 10, this actually has crippled economies, shut down industries, destroyed sectors, caused job loss, probably enduring in some areas. It's unevenly hit society. Not all industries have been impacted the same way. So hospitality industry has been crushed by this, absolutely crushed. And the nature of those activities where people get together with masks off and can trade pathogen, unfortunately, is the thing that has driven that. That is a behavior and activity that we like. All of us, most of us enjoy those settings quite a bit. And they are unfortunately the settings that cause the greatest risk of transmission of disease. I think sadly, it's been a difficult concept for people to understand. When they hear small numbers like, well, only 1% of people die, people don't fully appreciate that when the entire human population is effectively a potential target for the pathogen all at the same time, when there was no immunity for the whole population, that 1% of 330 million Americans is 3.3 million people. I mean, people don't realize how big that number is, and that were there unfettered spread, the possibility of half the country getting infected over a 12-month period is very real. That's not a stretch. And so half of 3.3 million people is still more than 1.7 million people. I mean, or around 1.7 million people, 1.6 million people. So you're talking staggering numbers. And if you translate that to Kentucky, we have a little over 3,200 deaths so far in Kentucky. And if we had 1% of all of Kentuckians die, it's 45,000 people. And if we had half of that die, it's 22,500. And if we had half of that, it's 12,250. So, I mean, those are big numbers. And I don't think people realize now that as COVID has become the third overall leading cause of death in the United States of America, with over 400,000 people taken out by it in a year, just how staggering this is. And so I think it's with a great deal of humility that I take on my role in this response. And with great pride and appreciation, I work with all the other public health professionals and healthcare providers and other leaders in society as we've tried to navigate this, because it is really, quite frankly, like having World War II globally distributed across the whole population. And it is that difficult. So let's all just keep in mind a sense of humility and recognition for just how big this task is and what it has cost so many people. So now, as we've gone through this, we've had staggering crisis after staggering crisis. We went through the spring and shut things down because there was so much we didn't know about the disease. We didn't have ways to treat people. We couldn't get PPE, right? We had no therapeutics. We didn't even have testing to find the disease when people had symptoms. Was it COVID or something else? So we had to build a whole new testing infrastructure for a single disease. We had to scrounge and compete with each other state by state and nation by nation to get PPE. We had no financial resources, so the federal government had to provide an unprecedented magnitude of federal relief to try to help support this. We had to do unemployment support for whole sectors of the economy. And folks, let's just all be honest. We've done a lot, but we didn't do enough. This is something that we could never adequately help make whole all the people who have been hurt by this. And so let's, be sympathetic and empathetic for the plight that so many others still find themselves in. Healthcare, which normally is, say it's recession proof, right? Well, look what happened. I'm an emergency physician. I practiced for 20 years almost before being a public health commissioner forced me out of the clinical environment. Emergency medicine saw their volumes fall by 30 or 40%, and it hasn't fully recovered in lots of places. That's unprecedented for that specialty, and it's caused real problems for folks all over. So we now come to this stage in the journey where we know more about the disease. Even though we still don't have a large armamentarium of treatments, we have some treatments, and we know better how to handle people with the disease. So mortality is falling like you would expect. The testing system is much more mature. We can test much more readily and in many different ways now than we could before. We have an experiential base with the disease, so we are getting a better sense for how we can calibrate interventions for social behaviors to try to get most of the benefit with less of the harm. But the interventions, because they require social distancing, mask use, and staying home if you were exposed or if you're sick, have bigger implications and still have substantial implications. So there's all of these challenges. It's all staggeringly big, and everyone is ready for this to be over. So I can see some people in the gallery. If you're not ready for this to be over, raise your hand, and you can all look and see if anyone raises your hand. Everyone wants our lives back, right? Kids in school, we want to be able to go to a restaurant. We want to be able to go to a theater. We want to be able to go on a vacation somewhere that we can get on an airplane or get in a car and go somewhere else and stay at a hotel and do activities, right? All of us want that, and that's the goal. It's been difficult, though, because people who are in distress, people who are in difficulty can become desperate and feel desperate. And I think we've seen that. And it's normal, it's human, it's predictable, and it's part of this journey, unfortunately. But that leads us up to where we are right now with the vaccines. I will tell you, as hard as this has been from a public health standpoint, and it has been hard, our team that does data with epidemiology has been crushed trying to build expandingly bigger systems and use software and technology that, quite frankly, wasn't probably good the day it was bought in the 80s, and try to make it work in 2020 for tasks it was never designed for and could never handle. And it has felt all along like the whole operation's held together by bubblegum and duct tape. And we're just trying to hope that the ship doesn't sink and the plane doesn't crash every single day. Even though we've gone through all that journey, let me tell you that the vaccine deployment has been the absolute most difficult, daunting, challenging task of the whole journey. And quite frankly, it has been the most nightmarish part from the perspective of all of society has this perception there is an asset out there to be given and that someone is just keeping them from it. And so someone is to blame because they don't have it. And let's make this problem a little bit different. I want to put all the variables on the table, or at least enough of them, to describe just why this is challenging. And I know I'm talking to pharmacists here, so a lot of this stuff you're going to understand in a way the general public is not. So I'll give examples that I hope make it more real. We have a situation where if you take 100% of the population, 18% or so are under 16, that the vaccines are not even authorized for use in that population yet. That's a little over 800,000 people you take off the top right there in Kentucky. So 4.5 million is down to 3.7 million. I'm an ER doc, I use rounded numbers, and so you'll have to just accept that. So there's 3.7 million people left. We have a situation where, depending on where you are, 30 or 40% don't even want the vaccine. They either are hesitant because they're concerned, is it safe, or they don't believe in it, or they don't think the disease is real, or they think it's overblown. Whatever their reasons are, you take another 30 or 40% off the top. So now, to do the math more easily, I've talked at least 50% of the state is either not eligible or doesn't even want the vaccine. So you take 4.5 and you divide, or 4.5 million, and you divide that in half, you know, and now you get to 2.2 million. I'm rounding down because it's more than 30% who are hesitant right now. So you get to that number of 2.2 million or so. That's the addressable audience. That's the people who are 16 and over who would take the vaccine today if we could offer it. We don't have anywhere near that amount of vaccine. We don't have anywhere near that amount. And so the quantities that are going out, when they say that 40 million doses, you know, I'm just using, again, round numbers, say 40 million doses have been shipped so far. It's 40 million doses, that includes 2 doses for some of these things. So what the actual number is, it's no more than 20 to 40 million people, somewhere in that range, who could have been vaccinated by now. Again, that's less than 10% of the total population for the United States of America, okay? Because 33 million would be about 10% of that 330 million. So you're looking at, even if it could have all been deployed and all administered immediately, you'd only still have reached 10% of the population. And here's more problems. These things you'll understand because you deal with this in your practices. It's if you remember when you were kids, the math problems we used to get. You have a 10-gallon bucket, a 5-gallon bucket, and a 3-gallon bucket. Put 2 gallons in a bucket. Anyone remember that? I see any show of hands? And you had to dump the water from bucket to bucket until you got just 2 gallons in one bucket. Well, here's the problem. We get about 55,000 gallons a week, or doses, okay? And we have a 975-gallon bucket and a 100-gallon bucket. And people are telling us, we want you to put 33 gallons here, 2 gallons there, 118 gallons here, 5,000 gallons there. So first of all, you can't do it. You can't use the size, minimum shipment sizes, and distribute it with the precision people want. It is not mathematically possible just with those 2 minimum shipment sizes. Add to that, the Pfizer product in the largest bucket has extreme storage conditions that the vast majority of sites cannot fulfill. And those shipping containers that they were hopeful, and I'm not, there's no criticism here. I'm not criticizing the federal government in any way when I say these things. I think they were hopeful those shipping containers would be a more viable solution, but they found that they were less durable than they had hoped, and they were worried they were more at risk for failure than they had hoped. So one of the individuals at the senior level from the federal government said, you know, the shipping containers were not worthy of the multi-million-dollar content contained therein. All right, now that's not to criticize the people who designed them and made them. Remember, they're doing all of this on short notice, right? And creating new solutions to problems we didn't have before. So there's no criticism, this is just reality. So now you have only a limited number of places who can take the 975-gallon bucket, so you can only distribute that so far. So you have all of these fixed, rigid distribution problems that are logistical challenges. And then, by the way, none of these vaccines were approved. They were both approved by EUA, so they're not even full biologic application approved. They're not BLA approved like a normal therapeutic. They're emergency authorized. They were authorized and first available for shipment was Pfizer December 14th, Moderna December 21st. The guidance for how to use it and on whom it should be used was published either concurrent with or after it was shipped. All right, so think about that. We shipped a pharmaceutical, emergency authorized, and told you who to use it on and how to use it after they shipped it. All right, is that how this normally works in the pharmaceutical world? Anyone here, raise your hand if that's typical. And we shipped it out the last 2 weeks of the year. Does anyone have a hard time staffing a pharmacy over the Christmas and New Year's holidays? Does anyone find that people want to be home for the holidays and with people? And there's other holidays there too, but the Christmas and New Year's are the ones I mentioned. Oh, and by the way, this year it just so happened that it fell on Thursday and Friday, both of them. So it guaranteed we had 2 4-day weekends at the end of the year. All right. Oh, and one more thing. The federal government, who invested so much money to accelerate the development and approval of these drugs and the distribution through a distribution channel, did not assign virtually any money to the last leg of the journey, which was the administration phase. So putting the shot in the arm. They said, bill a health insurer to get that money. Okay. And it wasn't until after Christmas that the President of the United States signed the aid bill. So it was in the middle of this, after deployment had already started happening for both of these pharmaceuticals, that we found out we might have money, but the guidance for how that money can be used didn't come out till last week. All right, so I hope I've just put this in context for you. There's a whole lot of reasons why December was going to happen the way it did, and why January is going to happen the way it is. I refuse to accept that it was a dismal failure in December. I think it is, I love reading history. I say that at the press conferences. Because we're not in the press room like we used to be, I don't get to tell my little stories and stuff like I used to the same amount. But I read history as much as I can. It puts things in perspective. Prior to the COVID vaccines, prior to the SARS-CoV-2, if you want to be more precise, vaccines, the fastest commercially developed vaccine, as I understand it before this, was the mumps vaccine, and it took 4 years. We now did in 1 year, not just 2 vaccines that are approved for use, but over in Europe, they got AstraZeneca. We have here the Janssen one likely to go forward for its EUA in the next couple of weeks. And there are hundreds of other vaccine candidates globally, not hundreds of which are going to be ready soon, but tens of which probably will be in various stages of approval in the months ahead. It's nothing short of a modern medical miracle and incredible accomplishment, particularly when you think these 2 mRNA vaccines, we had no commercially produced mRNA vaccines before this. And the lipid nanoparticle that encapsulates that is apparently particularly tricky to manufacture. So it's not actually the mRNA kernel. It's not the malt in the milk dud that's the problem. It's the chocolate that encapsulates it that's the trouble. That's the hard manufacturing task. So they can't just scale this as easily as you would want. So we have this wonderful accomplishment, and we should be celebrating that. Oh my gosh, we have a chance to have a light at the end of the tunnel. We just have to be disciplined to keep wearing our masks and socially distance and get through into the further part of the year, and we will be able to immunize and keep protected from severe disease the vast majority of people at greatest risk. But what's happening, unfortunately, is people who are fearful, people who are scared, because this disease does cause people to die, particularly older folks who are over 70, and particularly people who have certain high-risk conditions. People want it, and they want it right now. So even though I said half of society either isn't eligible or doesn't want it, the third of society who wants it are being particularly loud right now. And so we have people who are angry, accusatory, mad, upset, fearful, scared, all sorts of different things. And all of it comes into a bucket that the phones are ringing off the hook, the emails are filling up, whether it's a health department, a hospital, a pharmacy, a doctor's office, all over the place. And so what we have now is this challenge where those of us who have this opportunity and quite frankly, this obligation in our leadership roles have to find ways to inspire the rest of society, to appeal to our higher angels and realize this is a good problem to have, that we have these vaccines to deploy, but it will take time. Because the other part of the math equation I didn't share with you was when I talked about the 975-gallon buckets and the 10-gallon buckets, is when you add up the amount of gallons that everybody's asking, we have 55,000 gallons and people want 3 million gallons. And I don't have 3 million gallons to give. So people can accuse, they can argue, they can assert that things are being done inappropriately, but the reality is you can do all that all you want. It doesn't change the fact. There's only so much coming into the state. There's only so much that can be distributed. That reality does not change, no matter how much people complain about it. And it will get better. If you model this out, even at our low volume that we're getting right now, even at that low volume, by the time we get to late or to midsummer, half to 2/3 or more of all the people who really want this will have had a chance to have it. Now that seems like an eternity, but it's 5.5 months away. All right. This problem solves itself. We will not be having the same discussion in June because it will have gotten much better. But boy, oh boy, the next 30 to 90 days sure could be a rocky 30 to 90 days because everyone's upset. And so what happens, and this goes to I know that the audience here is please, let's put this in perspective. I shared this before we get into the big room. Even in this audience, there are some who want the vaccine right now, and there are some who say, I wish I didn't have to give vaccines. That was not what I thought I was going to have to do as a pharmacist. So there's a whole spectrum even within this population. I remember, I'm a past president of the American Medical Association. So I had the opportunity to be at the helm and advocate for physicians across the country. There's about 1.1 million physicians and physician in training and students in the country. And it was like herding cats. It was all over the spectrum. So as soon as you made a decision and made one portion happy, you thoroughly alienated another portion of that same profession. So I know a thing or two about how advocacy works and how hard it is at the umbrella organization level to reach consensus and have consistency. But let me be very clear about this part of the message. I, the governor, the state, we all want you to have vaccine. We all want you to be in the business of administering it. We all want patients to be able to go to all of your pharmacies and be able to get vaccinated. We all want that. That is our aspirational goal. If we had enough vaccine, I don't want to be in the distributor. I don't want to be the middleman. My team doesn't want to be the middleman. We would rather have you order just like you normally do. We'd rather have a situation that you're accustomed to probably with the influenza vaccine. You don't always know when it's going to arrive. You may not get as much as you want. You plan based on when the inventory arrives and how much you have, and you administer until you run out. We would all rather be in that model. I never wanted to be in the business of being a pharmaceutical distributor, and that's what we've had to do for remdesivir, for monoclonal antibodies. We have had to be in the business of being functionally the middle person distributor of these different pharmaceuticals because they were scarce and someone had to adjudicate how and where they went. We don't seek to and desire to be in that business, but we have to be in that business because that's the system that was set up and it's a scarce resource. Let me give you a few other parameters on this for why right now it's just simply not possible to give everybody vaccine. If you take 55, we have 1,500 locations who are already in the queue to be vaccine administration sites, somewhere in that ballpark. The governor did this last night. If you take 55,000 and divide it by 1,500, it'd be like shipping 37 doses to every one of those sites across the state. One, we can't do it. I just told you that because of the storage requirements and the quantities we can ship. But if we shipped it 37 doses to 1,500 different places, you know what happens? There's no functional market. It means that some places are going to run out within an hour of getting it, and other places may have to work a few days to get rid of it. And what happens is the public has no idea where to go to get it. And so they don't know where to say, I want to get it and sign up to get it. And then I'll tell you what has happened already in the first 7 weeks of this. When vaccine administration sites get it, even if you explain, here is the current guidelines and what will be done, a lot of the people who get it think of themselves as a strategist, and it is, I'm the one who knows what's the best thing to do with it, and I'm going to do what I'm going to do with it. And then the public gets really angry. So let me put this in context for you. They get really angry because everyone has stories. Well, so-and-so got it here and I can't get it there, and so-and-so got it here and I can't get it there. And so we have all this inconsistency. So in the beginning, with these scarce quantities, we have to find a way to make a more rational marketplace where the public at least know where they can go to sign up and raise their hand. And they can get in line and they go to a place if they want to get it. And we have to work on a way to make that more rational, more consistent, more clear, so that the public is less fearful, feels that there's more clarity, that the team is all on the same page, and that we're working towards a shared common goal. So that's part of the reason that some of these parameters are changing over these coming weeks as we work towards a different model. The other thing is the whole inventory management system, first dose, second dose, 2 different products, us trying to manage it. You know, there's whole logistical companies who do this professionally, and for pharmaceuticals and other things, it is a challenging, nightmarish task. And of course, you've all seen the consistency from the federal government is variable from week to week. What are you going to get? When are you going to get it? And now you probably all noticed that a new president was sworn in a couple of days ago. And I have on my bookshelf above me here, you won't be able to see it probably, right up here is I think it's a 60-year Etch-a-Sketch. It's like a diamond edition Etch-a-Sketch, because I told our team, all the plans we make are written on an Etch-a-Sketch, and it's like someone comes in every day and shakes the damn thing 3 or 4 times a day. All right. So they gave me this diamond edition Etch-a-Sketch to memorialize that part of my journey. That's what's happened. So then folks look at us and they say, you're not consistent. You're not doing what you said you would do. Well, we can't, because the rules keep changing. And so we're having to innovate and solution solve every single week with all these complexities. So as I wrap up, because I'm past my 35 minutes, and I promised Joel and Jill I'd give them a few minutes if they had any questions. We want you to have vaccine. We want you to vaccinate patients. We want you in the business of helping us with this task. As quantities increase, we're going to enroll all of your sites that have applied. We're going to get you all ready in the queue. And as quantities become available, we will enrich and expand the network. But for right now, really, really, really hard decisions have to be made about how we try to get the overall distribution more population proportionate and find ways to try to prioritize those people who are most vulnerable and most at risk, so that we can try to make sure they at least have a way to get it. We are going to also resource public health. We are committed to advancing health equity. We are committed to reaching vulnerable populations, not just the ones that were reached with the CVS Walgreens program for nursing home residents, but others. We know that that is an important and essential task, and we are working to build that into the program too as we go forward. And I would just have to ask you, as you read news coverage or hear things on social media, please first assume it's wrong before you assume it's right. Because I'll just tell you, the things that are shared with me show a whole lot of misinformation and misunderstanding. What I'm telling you is we're committed to try to make this as rational as possible and include as many participants as we're able as the supply increases. So Joel and Jill, let me hand it over to you. And if you have a couple or a few questions, I'll try to answer them in a very focused way.
Sure. Well, Dr. Stack, I can't thank you enough for the time today. I know that the Etch-a-Sketch the analogy is spot on, because as I know you're well tuned to work with changing situations with your experience in the ER. This is like that on steroids, I'm sure. So, but I can't thank you enough for your time. I'm gonna throw it over to Jill and see if she has any questions first before I might follow up with 1 or 2.
Thank you. Just a quick question. Over the next 3 months, could you maybe describe what you envision the vaccine rate rollout to be as you add new sites with Kroger, and expand that. How many vaccines? I know that that is definitely an evolving question as new information and changes come, but maybe that might give everyone a nice idea on what the next 3 months may look like and how pharmacists can help you.
Yeah, so I wish we knew, and anyone who tells you they know is either overconfident or just flat out inaccurate. Okay. So for the prior administration, you had the Health and Human Services Secretary saying there was a whole bunch of extra medicine they were going to shove out, or a vaccine. And then you had the warp speed head, the general, saying there is no extra stuff. We've already shipped it all out. And like, who knows what's correct? And then you had the Biden team saying, no one's talking to us. We have no idea what's accurate, right? So nobody knows, okay? So, I mean, maybe Pfizer and Moderna know what their production capacity is, but we don't know yet accurately. Here's what I understand from, as best I can piece together. There is no magic big reservoir of vaccine sitting in a warehouse somewhere in freezers that can just suddenly be surged out. It sounds like they're pretty much producing it and immediately distributing it. And that they tell us, here's your first doses and here's your second doses. And they define that there's 2 streams, but essentially it's real-time production coming off the line and going out to people. So it really is all a pure play, like how much can they scale up and make? Now, they may have anticipated the growth in production because they were going to turn on pharmacy partnership programs. Now, on this point, just so you know, we don't get to pick that chain. The federal program turns it on and they define who's going to be your partner for the state, for the federal program. Now, that was what the Trump administration said. We don't know what the Biden administration is going to do because the Etch-a-Sketch just got dropped off of a 100-story building. It didn't just get shaken this time. It got thrown off the top of the building. So we don't know what's going to happen. They may come in and say, okay, scratch all that. We're not doing that. We're doing this differently. And so they said, though, they would turn that on and supply it through a different supply line, that our quantities wouldn't be decreased. There would be additional inventory. So that could be they anticipated the growth curve in production and said this portion of the new production is going to go to that delivery vehicle. Now, the Biden team says they're going to put up big regional locations and do that across the country that the federal government will run. So we don't know. The Janssen product, people who are research locations, even within the state, have said that they understand they may have enough data to go forward with their EUA application as soon as the end of this month. And you saw how fast they acted for the first 2. So it could be that theoretically by the end of February, if that gets approved, we could have a 3rd vaccine. You know, the benefit of that one is it's single dose, but its performance characteristics won't be the same, right? It's not an mRNA vaccine. It's a different, I think it's a viral vector technology, more traditional. So it may not perform quite as well as the other ones. We don't know. And then there's also the AstraZeneca product, which has been approved over in Europe. But remember, we have the World Health Organization through their COVAX facility trying to get the vaccine and contracting already for 2 billion doses. And we have the rest of the world competing with us. And because the United States said we're not going to participate in the international community for that, we pretty much are stuck with the 6 candidates that we bet on, if you will. We bet on 6 horses, 2 of which are approved, and 4 more which are going through the processes of phase 3 or 2 and wherever they are in the trials. So we really don't know what the quantity increase will be. And when we get a 3rd or 4th vaccine, because we will, you know, like the Janssen product has real appeal, right? We know there are vulnerable populations who are homebound, who need us to go out to them to help them. If we had a refrigeration temperature stable product that only required 1 dose, even if it's only 80% effective, the ability to go out once and do it almost certainly protects that individual from the likelihood of severe disease, the kind of disease that might kill you or put you in the ICU. That's very appealing because now we can perhaps target that to help go out and get harder to reach, more vulnerable populations where the distribution model requires a lot more labor intense and personalized approach. So Jill, I wish I knew, but no one really knows the quantities. I just know this. We all anticipate Pfizer and Moderna will increase in some extent. But we all know there'd be a third and a fourth vaccine. When I told you 1/2 to 2/3 of all the people who really want this probably could be reached even at the current level by the end of June, if we get a third vaccine and if we have any increase, that just accelerates that earlier in time. And remember, we've said all along, it would take this entire calendar year for everybody who wants a vaccine to have had a reasonable chance to get it. And that means going all the way down to the 17 and 18-year-olds with no medical problems. So we are on a journey for the rest of this year. And unfortunately, folks just have to accept that. That's the journey we're on. We can't change some of these variables. Back to you, Jill or Joel.
So, well, Dr. Stack, I know it is approaching the time at which you have to go, and then I'll leave you with this. Again, I want to personally thank you for from the association, from the Board of Pharmacy, from all the professionals in the state. The key message that I take away today is to assist you all continually in trying to remain calm and to pass that calmness on to our patients in the environment and the communities in which we're in and serve, and then also basically to understand now that there's an extreme amount of patience that's going to be required on both sides. And I would say, I know you're trying to pull your hair out with the lack of vaccine that you have there, but you and I tend to have no issue with that anymore, since frustration is a key for us, it seems like. But we will be patient, and it's good to hear that you know that, and will utilize pharmacists in the center of this program moving forward at the point at which you can engage us, or at least when the federal government gives us enough supply and allows you all enough supply to disseminate out, within a manner that we can do more positive than potential harm to public health and the public society in which we live in. So I do appreciate you for your time. Please know that you have Michelle there, who's worked very closely with your team, and pharmacists out here are willing and ready to go, at a moment's notice. We are preparing.
Well, Joel,
But we will continue to prepare.
As people drop off and as I drop off, thank you for your service to the people of Kentucky. I am personally, and I know we as Kentuckians are very grateful for what you do. So I learned earlier in my journey when I was in leadership at the American Medical Association that I wished I said thank you quicker, earlier, more often, because I really am grateful for what you do. We're in this together, and together we'll get through it. And if I want to use the way the governor says it, we'll get through this together. And believe me, we say that to reassure ourselves sometimes, not just to reassure you, but we will. And our performance as a state, here's my denouement, I think is the French way to say the end here, the wind up, is we, based on our overall health status and our relative lack of financial resources for Kentucky, by every measure, we should have had a far higher mortality rate. We should have had far higher numbers of people who had medical harm from this disease. And the fact that we have performed generally in the top 10 of all the states for more, low mortality, and some of our storage of PPE and our testing system that we built is a true testament to the people of Kentucky. And the hospitals and the healthcare providers and the laboratories, and now as we enter the vaccine deployment eventually, as we get enough vaccine, the pharmacies and others, it's a testimony to the state coming together, and I'm grateful to you for that. So thank you very much. I'm going to drop Joel and Jill. I hope you all stay well. And thanks for your leadership in helping us urge calm as we go through this, because it does make a difference. So thank you very much.
Thank you, sir.
Thank you for talking to us.
Thank you, Dr. Stack.
You're welcome. Bye-bye.
Okay, so I want to thank everybody for joining us today. We appreciate your presentation or your participation. Wow, that's hard. We recorded this for those colleagues that either want to rewatch it or you want to pass it on. It's on the kphanet.org website. Please feel free to go on there and access that. We will continue to try to disseminate out to the profession as much information that we get via either e-blast, either from, I know the Board of Pharmacy continues to work aggressively to try to reduce barriers out there, so that when it does come out in a larger scale to more and more pharmacists having access to it. We can better make sure that you are prepared and your staffs are prepared to tackle this, once in a lifetime situation, hopefully. So I want to thank everyone out there that's on the front line. You keep fighting. As you saw from Dr. Stack, they know that pharmacists are here, and it sounds to me like they're just as frustrated not having the supply to get out there, because they see how eager we are, as we always are, to take care of our communities and take care of our patients. So hopefully, if we can do this again with him or someone from his staff, we'll try to do that and bring that around to everyone. But just try to stay safe. Try to go back with the messages that you got today, and understand that there are things working behind the scenes to, try to get this vaccine or try to get you out to maximize your capacity in providing health and care to your patients. So thanks for joining us today. Jill, is there anything that you want to add as we depart?
Joel, I think you said it all. I echo your comments. Thank you to all the pharmacists who have been already working, giving vaccines, preparing for when you're ready, for when we have access. I think that we all want to participate and improve the health of our Commonwealth and have good hearts. And I'm excited to see us be able to do that across the state.
So thank you, everybody. Have a great day and a wonderful weekend.